your discharge be lying to you? You've probably seen that clear, stretchy egg white mucus in your underwear and wondered, does this mean I'm ovulating right now? Or did I already miss the window? Today I'm going to teach you exactly how to read your body signals. We're doing the stretch test to identify your peak fertility, and I'll explain why seeing this fluid doesn't always mean you've released an egg. Do you know there's only 12 to 24 hours each month when the egg can actually be fertilized? However, the fertile window, the time you can actually get pregnant, is usually 5 to 6 days. Why the difference? Because sperm are survivors. They can survive in your reproductive tract for up to 5 days, waiting for the egg, but they can only survive if they have the right environment. That's where your discharge comes in. Cervical mucus, on the other hand, is special. Right before ovulation, estrogen spikes and your cervix produces a specific fluid designed to help sperm swim. It becomes clear, slippery and stretchy, literally like raw egg white. This is the superhighway for sperm. So how do you know if you're in that window right now? You do the stretch test. Wash your hands, always step 1. Take a small sample from the opening of the vagina or check the tissue after you wipe. Place the fluid between your thumb and index finger and slowly pull them apart. If the fluid breaks immediately or feels tacky, you aren't in that peak window yet. If it stretches several centimeters between your hand without breaking, that is a strong sign you're in the fertile window. Now here is the $1 million question. Does seeing this mucus guarantee that you've ovulated? Here is the medical truth. Cervical mucus is sensitive. It can identify your fertile window up to 96% of the time, but it's not specific. Think of it as a signpost saying ovulation is approaching, but it doesn't confirm the train actually arrived. Sometimes you'll see fertile mucus even in a cycle where no egg is released. Your body tried to ovulate, produced the estrogen, made the mucus, but the egg didn't launch. A quick GP warning, if you're watching this thinking, great, I'll just avoid sex when I see the mucus to prevent pregnancy, please be careful. Fertile days can start before you see the classic egg white texture. Sperm deposited on a creamy day can sometimes survive until the egg white day. If your goal is reliable contraception, rely on pills, coils, implants or condoms, not just the stretch test, unless you have extremely strong training in natural family planning. So if mucus is just a signpost, how do we confirm the event? LH strips, these detect the hormone surge before the egg releases. This can be a bit more accurate than monitoring discharge alone. Basal body temperature, your temperature rises after ovulation. Saliva testing, you can see a fern pattern in your dried spit under the microscope 24 hours before you ovulate, and there are home test kits for you to look into this. Progesterone blood test. As a GP, if I want to know for sure, I order a day 21 progesterone test, and this can show me if you've ovulated. Ultrasound is, however, the gold standard, though obviously you can't do this at home. Finally, if you're actively trying for a baby, when exactly should you have sex? The best time is the days you notice that peak quality mucus, the slippery, stretchy stuff. Experts recommend having sex every 1 to 2 days during this window. And don't wait for ovulation itself. You want the sperm waiting there before the egg arrives. However, this peak quality mucus does occur about 2 to 3 days before ovulation. So having sex on the exact day you see this mucus and the 2 to 3 days afterwards is really good if you're trying to conceive. So what's the bottom line? Use the stretch test to time your conception, but don't use it to guarantee ovulation. But what if you check all month and you never see egg white discharge? Or what if it smells weird? In part 2, I'm going to cover the red flags of discharge and what to do if your fertile mucus is missing. Hit subscribe so you don't miss that, and I'll see you on the next video.